This short video is going to be covering the cervical plexus and the first part of the brachial plexus slides. So first we're going to come into the cervical plexus. So first, before we even discuss the cervical plexus, I just want to show you guys a plexus is a network of nerves. It's a bundle and overlapping and combining network of nerves. We have 4 different plexes in the body that we're going to talk about as part of this class: the cervical plexus, the brachial plexus, the lumbar plexus, and the sacral plexus. So there's these 4 different plexes that follow patterns where it's just an overlapping combination of nerves that come off of ventral rami. So the first plexus that we're going to talk about is the cervical plexus because it's the most superior. So the cervical plexus is made up of the first 4 cervical nerves of the ventral rami. Remember, there is a cervical nerve between the atlas and the occiput, between the occiput and the atlas. So we have in total 8 cervical nerves. We've got C1 through C8, and in the cervical nerves, C1 through C7 are going to come out superior to its named vertebrae, and then C8 will come out just below C7, and then from there on down, T1 and below, they're going to come out in connection with that named vertebrae. So the cervical plexus is made up of the first 4 cervical nerves, C1, C2, C3, and C4. It's going to supply the regions of the neck and the upper shoulder and a little bit into the chest, and I'll show you guys that. And then as part of the cervical plexus, at times we're actually going to lump into the brachial plexus at C5, and this is part of the reason why you hopefully recognize from lab or from your previous study of the brachial plexus that phrenic nerve, which supplies the diaphragm, is going to have some overlap between the cervical and the brachial plexus. It's going to be C3, C4, and then C5. C3 and 4 will be part of the cervical plexus, and then 5 is lumping into the brachial plexus. So partial innervation of the diaphragm from the cervical plexus. The other part comes from the brachial plexus. So I just showed you guys this image here of the network of nerves from 1, 2, 3, 4, and then we're going to loop in 5 here because it's going to supply part of the phrenic nerve, and then there's some additional overlap. So we're going to lump in C5 here just to complete that picture of the cervical plexus. But you'll see inside of the cervical plexus, we've got many different nerves that are going to be supplying mainly the muscles and the skin of the neck, a little bit of the shoulder, and then with these supraclavicular nerves, a little bit into the chest as they drape down cutaneously. You're going to notice here nerve to trapezius muscle, which is going to be that spinal accessory, nerve 11. We're going to have a nerve to the sternocleidomastoid, which again is going to come from this spinal accessory, cranial nerve 11. We do have an additional cranial nerve, which is going to be looping into the cervical plexus with this hypoglossal nerve, which is going to supply innervation to the tongue. So we have several nerves, important nerves here that we can account for. This lesser occipital nerve, which is C1 and is only, or excuse me, which is C2 and is only sensory, and then our C1 is going to be only motor to those suboccipital muscles. And I think that's what I want you to glean from this slide, is the network of nerves and how each of these ventral rami are going to contribute to multiple nerves that are then going to go and accomplish functions. So now I'm going to move into this slide of the cervical plexus and kind of break out a few of those nerves individually. So the ventral rami of C1, 2, and 3 will contribute to this loop of nerves called the ansa cervicalis, which is going to be important in supplying musculature of the neck, and then some cutaneous innervation in the neck, chest, and shoulder. We saw this, C2 and C3 are going to give off many nerves: lesser occipital, transverse cervical, those supraclaviculars down here, C3, okay? Where was that? And then the greater auricular, so that's going to hit our ear. So skin of upper chest, shoulder, neck area. Now we're going to loop in part of the brachial plexus with C5. So 3, 4, 5 is going to be that phrenic nerve. And then once again, C1 through C5, lumping it in to give us that complete picture we're going to have nerves to the levator scapulae, to the scalene, sternocleidomastoid and trapezius, which we saw here, which is that accessory nerve coming down, nerve to sternocleidomastoid, nerve to trapezius muscle. So that's spinal accessory. The ventral rami will supply the scalenes. And then dorsal scapular coming off of C5, particularly C5, is going to be that dorsal scapular nerve. Now we're going to move out of the cervical plexus and move directly into the brachial plexus, which is formed by the ventral rami of the last 4 cervical and first thoracic ventral rami. So C5, C6, C7, C8, and T1. In our drawings, so going forward, there's going to be a bunch of pictures here of drawings of the brachial plexus, and I'll try to go through and give some thoughts about a couple of these. But in our drawings here, we're going to start with our ventral rami, move into the trunks, the superior, middle, and inferior trunk, then into our divisions, anterior and posterior, into the cords. So we're moving laterally as I'm going along. So we start immediately with the ventral rami right next to the spinal cord. We move into our trunks, move a little bit more lateral. We get into our divisions, then our cords, and then finally at the terminal ends we have our branches. But the branches are going to be kind of scattered throughout the brachial plexus, as you'll see, or as you've seen. And so this is kind of the logical progression that we'll move through as we learn this brachial plexus. So these next couple slides, it's very, very advantageous for you to learn to draw the brachial plexus. I think if you learn to draw the brachial plexus and then associate each nerve with the muscles that it innervates, that's going to be a very solid foundational base for you to understand how nerves are then going to innervate the muscles, and how if you have problems with a specific nerve, how it then translates into musculoskeletal problems on down the chain that then can result in some movement dysfunction. So again, start with your roots, move into your trunks, and as you draw this, try to help yourself. Why do you think this is called the superior trunk? Because it's going to be the one that's the most superior. Why is this the inferior trunk? Because on the spinal cord, it's going to be the trunk that's the most inferior. Our anterior divisions will come towards the front. Excuse me, they're in the black. Our anterior divisions will come to the anterior side. The posterior will go to the posterior side to meet the posterior cord. When you get to these cords, the posterior cord is in the back. The lateral cord is going to be the one. This is right in the spot where the brachial plexus is starting to make a curve. And so the lateral cord really is the most lateral, and the medial cord is the most medial. And you can see that if you think about your human anatomic position here, that ulnar nerve is going to sit the most medial of the bunch, which makes sense. It comes from the medial cord. The musculocutaneous is the most lateral of the bunch, so it comes from the lateral cord. Posterior is going behind. It's going to go and innervate that, or give rise to the axillary, which is going to the deltoid. Radial is going to be all of the posterior arm on down. And then medial and lateral come together to supply that lateral portion, the lateral portion of the arm, because we have ulnar doing the medial portion. Median's going to go on down. So if you can learn to draw this and then begin to associate where these guys run to and what they innervate, I think that's going to be your basis to understanding this brachial plexus. So as you roll through this, there's several different pictures just to kind of give you different views on the same thing. So this one is a very basic one. Realize these are all going to be coming from the ventral rami. So these ventral rami are going to combine. Something I think that we can glean from this slide here is realize each of these ventral rami come from a very specific segmental innervation. So C5, right? C6, C7, these are very specific segmental innervations. However, because of the nature of the plexus, we're going to have combination of these segmental levels. And so when we actually come to the terminal ends of these, we're going to find that inside of any given nerve, like the musculocutaneous nerve or the axillary or the radial, we're going to have contributions from several different segmental levels. So for example, the musculocutaneous is going to be a combination of the anterior divisions of the middle and superior trunks. And so as we come down, that musculocutaneous is going to still have contributing portions from C5, C6. Look at radial here. Radial is going to have combinations on the posterior division of all three trunks. And so we're actually going to find portions of C5 through T1 on that radial nerve as it comes down. So you can see as we come to the terminal ends that several different segmental innervations are contributing to the peripheral nerves as it comes down. This is another example of that, right? Where on occasion, in at least one of the cadavers in the 440 lab, there is a branch of C7 going to ulnar. If that branch of C7 does go to the ulnar nerve won't just be C8T1, but it's going to have a contribution from this middle trunk, right? Middle trunk via the lateral cord into the ulnar nerve. So it will include C7. Keep going down here. Another view on a different thing. Just look at the combinations of how each one of these colors is representing that segmental innervation, and how each segmental innervation is going to contribute to different peripheral nerves at the end because of the nature of a plexus. That's what a plexus is the combination of these segmental innervations. And then a few more views on that. So the last thing I want to hit as part of this video is just realizing that even though these are plexes, so I'll come back up to, let me come back up to this one. So even though these are plexes, they still follow the pattern of a typical spinal nerve. So for example, the C5 root here and the C6 root, these are the combination of the ventral rami of C5 and C6 giving rise to the superior trunk. Upstream to these ventral rami though, we're still going to have the typical pattern of a spinal nerve with a dorsal ramus, with a spinal nerve that's mixed, and with a ventral and dorsal rootlet. So that pattern is still going to be followed, and you will see if you look at innervation of muscles in the back, so our muscles that are innervated in the back, like the trapezius, like the semispinalis muscles, like the longissimus, they are still going to have segmental innervation of all of these roots via the dorsal ramus of that root. And you might pause and think, well, how can that be? Because all I ever think about here are this brachial plexus. But just realizing that these are the ventral rami of that spinal level, and as part of that, they still are going to have all of the upstream architecture which make up a typical spinal nerve. So we're still going to have our dorsal ramus going to the skeletal muscles and skin of the back. We're still going to have our spinal nerve and our rootlets leading into the spinal cord. And that finishes this video of the cervical plexus and the brachial plexus part 1.